الله وبركاته. مساكم الله بالخير. سعيد صراحة أنه نكون موجودين في this annual event. جمعية نشطة وإن شاء الله تكون جهودها مثمرة، ونطلع إن شاء الله المزيد من المشاركة مع جمعية العمود الفقري وأيضا مع جمعية السعودية للعلاج الطبيعي. I'm very happy that the previous three talks were talking about يعني personalized care the importance of individualized medicine, and then moving into يعني the final talk by Dr. Muhammad, where he talks about how can we shift our direction toward value-based healthcare. So it's a good segue to start what I want to share with you today. So three main messages, which are: what is the value-based healthcare? Something theoretical, probably most of you know it. Then why payers, which I'm presenting today, interested in such model, and then what does value-based healthcare look like in spine care in general. On a nutshell, value is not something that, usually when people talk about value-based healthcare, they think it's something that if they do, then that's value-based healthcare. So value is something variable. You might change based on what is the value that you want to achieve. So maybe in a year, the value is moving from a point A to point B. Next year could be moving from point B to point C in any given healthcare strategy. So any value should focus on health outcomes that matters to patients, divided by how much do you spend to get that outcome. We're into a very unstable, non-sustainable health model. Unfortunately, if you look into the health economics of Saudi Arabia, we have a unique situation in which any other cost factors, how much is the inflation and overall in the country, and then compare that to GCC and the other top 5 healthcare systems, and even if you compare it to the consumer purchase index, which is how much any household in Saudi Arabia pay for goods, you will see that there is almost a flat curve. يعني احنا نتكلم على it's something around 5% plus minus. But if you look at how much the health insurance system spends on health, we're talking about 16%, and it is on the trajectory of increase, and this is unique to Saudi Arabia in comparison to other countries in the region and in the globe. Why is that happening? I think the system is not functioning well by design. You have providers with a market that is looking to budget based on activities. So how much of patients did I see? How much from those patients? How many tests do I do? How many procedures that I do? Of course, there is an indication to those, but the thinking process is in what we call a fee-for-service model. This, by design, increases the utilization. By design, the government and the regulator looking to expand the number of benefits that is covered in something we call the essential benefit package, which is the minimum that the government regulate for any insurance policy to be given in the private sector. And this is to increase the coverage and to improve the accessibility to care, etc., for the better health of the organization. However, what we do as an insurance companies, we take that cost, which is increasing on an annual basis, and we pass it on to who pays for it by design, which is the employer. right? So all of us know that the bylaws in Saudi Arabia says that every employer should cover his employees by a minimum coverage. Ta'meen, had adna, you have to pay for it. So we take that cost and we pass it to the employer. The employer then, find that kind of increase. I know of a big corporates, banks, that had an annual increase of 30% for 3 years in a row. So after 3 years, if they were paying 100 million, they will pay 300 million for the same service, unfortunately, without looking into how much of health outcomes they get. So number of people who are obese increased, number of diabetics increased. So the clinical outcomes or the health outcomes are not improving in a linear manner to how much we spend. So I just want you to understand what's the challenge that's currently happening. So then how can we break that cycle? And I think one of the initiatives that are excellent is to move the discussion away from fee for service to pay for performance through what we call value-based healthcare models. So a couple of steps, you establish a multidisciplinary team and a forum, then you define what is the gold standard, what is the care pathway or the guidelines that you want to be the gold standard. So when somebody deviates, you have to have a baseline for that. I'm happy today that the association has announced the low back pain guidelines. Dr. May and the team has done a great job doing it. So this is a good example of a guideline that you can use in order for you to benchmark the deviation from. Then you define KPIs for that, and you start collecting data, and then you start to put a financial incentives to whoever is according to the deviation and the scores of that pathway. So what are these metrics look like? So it has to be a number of outcomes, so clinical outcomes, in addition to patient satisfaction outcomes, then quality of life measurements, cost reduction measurements, and then patient-reported outcome measures. So collectively, they have to work together and be measured, and these has to be improved on parallel. So you cannot reduce cost and reduce the health outcomes that you want to do. So that's not what you want to do. A very good place and a reference is the ICHM. It's the International Consortium for Health Outcome Measures. It's a very good website. You can scan the code there and start a big journey on value-based healthcare. They have already the presets that are used for different diseases. Some of you are familiar with this slide where I presented last year in a different topic, but this is how the bundling or the value-based healthcare bundles will be different in a regular fee-for-service versus the value-based care. So on the model on the left, you will start a surgery, let's say, with a price of 50,000 riyal. Then with each complication you will pay, and then in any transaction for a rehabilitation, for example, you will be paying an amount of money. Then after 1 year, the patient or the system will be paying 30K, 80K without capturing what's the outcome out of it. Where in a bundle payment, it's different. So you put the predefined bundle in the beginning, and then you define what is the gold standard, and based on that, by identifying the patients, the comorbidities, and the other factors, you adjust for what we call the patient characteristics. So if this patient is diabetic, hypertensive, they have obese, comorbidities, multiple problems, the payment should be different. And then, following the same path, you would pay $60K in the beginning, then another $5,000 adjustment for that patient characteristics, and hopefully after 1 year, if the patient hits the outcomes that are promised, they will get a bonus payment. So all in all, maybe they will the provider will receive a higher value than the fee for service, and if they don't perform well, they will get an adjustment for that. And this is based on patient-reported outcome measures and patient-reported experience measures. In Tawuniya, we started a journey in a Center for Value and Health, and we have already a couple of organizations that are participating with us. Feel free to join that journey. You can reach out by our email, vbhc@tawuniya. Register your organization, and we'll be happily joining. You will be happily joining the team on that journey of value-based healthcare. And on a nutshell, it's a journey that has to start. The system lacks trust. So the current relationship between payers and providers is a love-hate relationship. We have to have a trust so we can start our journey of transformation. Thank you very much.